Welcome. This video is part 3 of a 9-part series and is intended for state, tribe, and territory disaster behavioral health coordinators and others involved with disaster planning, response, and recovery. The 2 learning objectives within this video are to first, define and identify the core components of effective partnerships, and second, to understand key considerations when building effective partnerships. First, let's define and identify the core components of effective partnerships. To build an effective partnership, put significant effort into planning the partnership development process. Everyone has their own agenda and their own perspectives, so you should take some time and effort to agree on basic understandings. During this process, bring the potentially partnering organizations together to identify and discuss their values, their goals for a proposed partnership, and their objectives for the partnership. Then, you want to move into identifying a role and a function for each partner. Finally, the purpose of the partnership is to get everyone on the same page during a crisis response. If all the prior steps are completed, then during a chaotic event, there will be successful engagement between partners because agreed-upon structures, plans, and protocols are in place. Next, let's talk about what we mean by effective partnerships. Effective partnerships are defined by effective leadership. A great starting point, and one that effective leaders use, is to identify a vision of what the partnership's objectives are. In this process, you want to give potential partners the opportunity to share their concerns. Could the partnership potentially affect a group negatively if there are political issues or turf battles over funding? It's important to identify these kinds of issues, since fostering a sense of safety in discussing conflicts is critical for the partnership to succeed. A key element of effective partnerships is a willingness to distribute power, allowing the process to be challenged by others. Essentially, an effective partnership is one where all entities have collectively agreed on a specific set of goals and outcomes for the partnership, and where all partners see themselves as equal in stature, power, and responsibility. Finally, any effective partnership must be measurable. That is, you have to be able to determine if the partnership is achieving its purpose. Some examples of partnerships in the field of disaster behavioral health include those at the federal level. One such example is the Interagency Agreement and the partnership between the Substance Abuse and Mental Health Services Administration and the Federal Emergency Management Agency to promote and support the Crisis Counseling Assistance and Training Program. There can also be federal to state partnerships, partnerships between states, and partnerships at state, regional, and local levels. At the state level, this may include pulling emergency management, public health, and public education into the process, as well as pulling in a wide range of potential non-governmental community leaders who also have a stake in disaster behavioral health. At the local level, this may include individuals from your local community mental health and substance use providers, and nonprofits such as the American Red Cross and Salvation Army, victim advocates, and private practitioners. Now let's walk through the key components of building effective partnerships. First, you want to define the purpose of the partnership clearly and succinctly. Also think about the value. Include what disaster behavioral health services bring to the disaster response and recovery, such as the role your organization plays in mitigating a disaster's impact on first responders. The next key step is to create clear definitions of each partner's roles in the partnership. Third is to create clear definition of the boundaries of the partnership. When does a specific partner's role in the response begin and end? Which partner takes the lead in which disaster event and which organizations provide support and resources? Next, you want to finalize the agreements. Formalizing these partnerships using a form such as a Memorandum of Understanding, an MOU, increases the likelihood of solidifying the agreements for a longer period. Finally, you must spend time maintaining the partnership through consistent and regular meetings, trainings, and exercises. This concludes the Partnerships video within the Promising Practices series. Thank you for tuning in. The other videos in this series will explore each of the standards that can enhance your disaster behavioral health plan. To view an expanded version of this video, go to www.samhsa.gov/dtac/webinars-podcasts and scroll down to the Promising Practices in Disaster Behavioral Health Planning series. Established by the Substance Abuse and Mental Health Services Administration, SAMHSA, the Disaster Technical Assistance Center, DTAC, supports SAMHSA's efforts to prepare states, territories, and tribes to deliver an effective mental health and substance use-related response to disasters. For training and technical assistance inquiries, you can call SAMHSA DTAC toll-free at 1-800-308-3515 or email dtac@samhsa.hhs.gov, or you can visit www.samhsa.gov/dtac. Before we conclude, we'd like to give a special thanks to Dr. Kurt Drennan, who contributed the original content of this video.